Hey everybody, Dr. Dad's coming at you today. I'm here with my good friend and commandant, Mr. Dr. Nick Jensen. How are you, brother?
Good, buddy. Don't ever refer to me as Mister. It's always Doctor,
All right.
okay?
That's true. We don't want to be called sirs. We're still too young for
That's right.
that. Hey, today I'm excited, man. We get one of our brothers in wellness to join us, one of our HCF fellow practitioners, Dr. Jason Saunders. Um, I want to really quick introduce him and then we'll get him going. And we're going to talk about some fun topics today and get into some of the neat things that Jason is doing, Dr. Saunders is doing at his practice. So let's talk a little bit about what he does. So Dr. Saunders he's always been fascinated by the machinery of the human frame and strives to learn everything he can that might help even one of his patients. Always working to integrate new knowledge and practical experience. In addition to being a doctor of chiropractic, he also has a diplomat with the Chiropractic Board of Clinical Nutrition and as well the International Board of Applied Kinesiology. He is one of only 250 professionals in the world with this distinction. He utilizes combined training in various modalities to create comprehensive programs and help patients achieve their goals. His patients deal with, among many other conditions, autoimmune, neurological conditions, allergies, autism, and cancer. So he combines and takes a multi-therapeutic approach using chiropractic, hyperbaric oxygen therapy, nutrition, exercise, detox programs, and more to naturally support patients and guide them through their health challenges. One of the neat things about Dr. Saunders is he actually practices with his wife, Dr. Melissa Saunders. They are both co-owners of a New Jersey HBOT USA and Core Therapies Family Wellness Center in Northern New Jersey, a holistic center with 8 chiropractors whose specialties include functional neurology, functional medicine, pre-postpartum, pediatric, and sports injuries. Core Therapies also offers acupuncture, massage, infrared, sauna, spinal decompression, yoga, and laser therapies. Buddy, I need to come work at your clinic.
There's a lot going on, man.
How are
You
you,
got a
man?
really fun naturopath over there.
Yeah. Well, great to be here. Thank you so much for inviting me on, and I'd love to hang out with you guys anyway for an hour or so, and getting a chance to talk about some of the things I love. So I'm happy to be here.
Yeah, it's awesome to have you on. When we first met you at, I think it was one of the masterminds, there's such a, there's a deep sense of knowing with you. You're such a, I say call it an old soul, but someone who just speaks. And when you speak, everyone listens, and there's so much truth that comes out. When I had the opportunity to listen to you at our last conference, I was blown away, and I couldn't wait to get you on here. So we're gonna dive deep into your story and whatnot, right, David?
Yeah, and before we do that, I'd like to I want to talk a little bit about how I actually met Dr. Saunders.
Yeah.
So I met him, I believe it was in Atlanta, right?
That's right.
This guy's intense. I mean, you meet him, like Nick's saying, he's very quiet. When he does open his mouth, there's brilliance that always comes out, but he doesn't say much until it's time to say the right things. So I remember seeing this guy, and he had this very intense look about him, and he walks up to me during the conference, and I remember what you told me. It was very simple, very, very straight to the point. He goes, "Hey man, so tell me about this stuff with this platinum program with HCF. Is this a bunch of bullshit or what?"
Listen, man, I'm from Jersey, so I just need it straight.
I loved it. Like, he was just straight to the point. Like, just give it to me straight. And so right there, I was like, I like this guy. So yeah, that's when I met him, and then now we've met the whole fam, and we're getting to know you better and better over the couple of years we've got to communicate. And this is fun, man. I'm really excited to see what you do and get into the passion and everything that you guys operate from. So Nick, you want to start it off and kind of dive into some of these things we want to get into today?
Yeah, I just basically wanted to hear some of your story, because we're going to dive into some cool stuff today on oxygen therapy, hyperbaric oxygen therapy, its role. And I found it interesting in the talk that you delivered. You said you bought one of these tools, and it sort of just sat in your place for a while, and then now it's become a big part of your life's purpose. So we want to hear, how'd you get into chiropractic and take us to where you are now?
Yeah, sure. So chiropractic. I mean, I had a few injuries as a kid. Was wrestling and playing on trampolines a lot, and had a bunch of lower back and neck things that were kind of creeping up, and finally blew a disc in my neck, and had a lot of issues around that. I had gone to a bunch of doctors, and was on some medication for a period of time. They were offering obviously surgery, and somebody eventually said, "Hey, you should go to a chiropractor." And I said, I was like, really? Because I've been to some really good neurologists and they can't help me. I'm not so sure a chiropractor is going to be able to do it either. So, but after, suffering long enough, I finally went, and literally within a few weeks, my issues were clearing up for the first time. So right away I said, wow, there's definitely something to this. And then, I continued getting treated throughout, that was in high school. So I continued getting treated throughout high school. And then he said, when you go to college, you really ought to not just discontinue. You should really, try to find a chiropractor up by you and keep getting worked on. So I did, and that chiropractor did a lot of nutrition work. So in addition to just some structural stuff, she started introducing me to, a much broader picture of what chiropractic could offer. And, she really took me from kind of asymptomatic to, actually well. And, I really ended up hanging out with her almost the whole time through college. I'd shadow her in her office. And then eventually, she actually was one of the teachers at the chiropractic school I went to. So, she sort of like mentored me into going to chiropractic school, which school to go to, and, which classes to take. So, she played a huge role in me, transitioning into chiropractic. About 4 or 5 years into practice, for some reason, I was putting a new roof on my house. I was doing it myself. And I actually blew a disc in my lower back, re-roofing my house. And so Melissa, like you guys mentioned, we worked together. So she's a chiropractor too. And I was in pretty bad shape. So she ends up working on me. And within about 2 or 3 weeks, I was, back together and I was working again. But I was left with pretty bad neuropathy on my right foot. So I had right drop foot, and I had numbness and tingling and weakness. And even about a year, about 12 or 13 months after the initial injury, I still had the same drop foot. It never changed. And so, at that point I was 28, I think. And I was like, I guess this is just how it's going to be. So I'm at a conference in, I think it was Las Vegas, and they had these hyperbaric chambers. I had no idea what it was, and looked cool. So I was like, hey, could I go in there? And they were doing demos. So I jump in, he zips me up. I'm in there for about 40 minutes. They unzip me and I start going around the show, just like a big, conference area with a big, vendor scene. So I'm walking around to the other vendors, and all of a sudden I get this like tingling in my foot that I hadn't had in, well over a year at that point. And I said, wow, I wonder if that's related to the hyperbaric. So I went back, talked to the guy. He's like, probably. That makes a lot of sense. And so he agreed to treat me over the weekend, actually. So I ended up doing about 6 hours of treatment over the course of the next 4 days. He gave me a couple books to read while I was in the chamber. And I left that conference with about 25-30% recovery in my foot.
Wow.
And so I was like, wow, I mean, this is, it's the first time it's changed, and it changed that much in, just a few days. So needless to say, I bought one. I self-treated. It took me about 3 months. But in 3 months, I was 100% recovered. And now, 12 plus years later, it hasn't even come back. So, clearly I was sold for it for me. So then my stepdad's got MS. So I said, well, gee, it helped me with my neuropathy. It's a totally different issue, obviously, but he's got a lot of peripheral neuropathy. Maybe it would help him. So I had him do about 40 dives in 40 days. So we did a pretty intense regimen. Every day he did between 60 and 90 minutes. And in 40 days, I mean, his gait normalized. He got feeling back in his feet. He started walking stairs again. He had energy again. So it was a massive improvement. So yeah, I mean, at that point I was like, I need to start introducing this to my office. But for some reason, like you said, it kind of just sat around for a while. I would handpick, patients that it seemed like, what, they're not responding the way I would expect them to respond to, let's say, normal chiropractic care, or, this disc herniation doesn't seem to be recovering properly, or, a patient with a totally unrelated issue, but I've read, hey, I think hyperbaric works for them. So I would handpick select patients and start putting them in the chamber. But it was only, 1 or 2 a month, and it was very specific to people I would put in. But every time I did, we were surprised, and I would tell people, I don't know if it's going to help you, but I think it's worth a shot. And I'm telling you, every single time we were amazed. Once that happened, at least about 2 or 3 dozen times, I was just like, I have to explore this and really start working and really start getting people educated on what it is and how it works and why it works, and really start getting people in. And I'd say over the last 5 years, and really over the last 2 or 3 years, we've massively increased our usage of the tool in our office. We have 3 hyperbaric chambers in our clinic that run, 10 hours a day, 6 days a week. And then we help families get hyperbaric chambers. We help other doctors buy chambers and implement business strategies so that they could help their own patients. And it's really just become like a huge passion for us because, like I said, I mean, it's something so simple, it's so safe, and the results are they're just unusually impressive. So we love using it, and we love seeing, the miracles that we see in our office every day. So
that's such a powerful message. Sorry to jump in there, Dave. But, what you just spoke to are 2 things in the Western medical model where they just talk about disease management. Oh, we've got some, cream for neuropathy, or, let's try to manage your symptoms. Let's try to decrease the symptoms, I guess, or try to slow the progression. But you're talking about, even your uncle, I mean, a massive turnaround in illness that's supposed to be, quote unquote, untreatable. And you're turning people's lives around. That's a phenomenal story.
It's one of those things where once you understand like the mechanism behind it and how it works, it makes complete sense. Mm-hmm. It's not something you would necessarily jump to without recognizing, exactly how it works, but it is. It's about healing. Oxygen is just, the fuel that our body uses to heal. And when you get a little extra, more than we can normally get, the body's able to just do what it does. It heals on its own. It's just getting this, excess amount of fuel, and it's able to utilize that in a way that we just can't we can't get oxygen any other way like this. So, it's an impressive process to watch.
It's amazing, those stories that you share. I mean, I'm sure there's listeners that are going to hear those and say, oh my gosh, this is something that I probably need to try because I haven't been successful, like you were saying with your leg that just kind of drug out for a while. And, I think we'll talk about the mechanism and why this is working and stuff. But before we get there, I think it's a good time to kind of talk a little bit about the importance of getting to different layers of the body to look for where the problems are, right? I mean, you were using chiropractic care, and I'm sure you were eating good and doing nutrition and some other things to try to help with the issue you were having with that drop foot. But it wasn't until you kind of went to another layer of the body and supported it there that you started to see more healing, right? Right. So it's like that analogy.
Yeah,
look at them. Go ahead. I'm sorry. Yeah.
No, it's okay. It's one of those things. It was like this big aha moment for me because, nutrition is my background. Fitness was, fitness and nutrition before I got into chiropractic. And, and then between the chiropractic model and just understanding, looking for root cause and getting the body to heal, and the body heals itself. And, I had this disc herniation. I got treated, and, the symptoms of my back pain got better, and I was, that was all improving. But, I was left with this neuropathy, and I was like, that doesn't make any sense. The body is supposed to heal. It was a shot to my understanding of physiology to say, why isn't that getting better? And, it's interesting because to me, oxygen, it's a nutrient. So I ate well, I was taking supplements, I was exercising, I was getting adjusted, I was getting treated, but oxygen's also another nutrient that we don't really always look at that way. And that oxygen deficiency, because of the injury, there was an area of ischemic. There was a low oxygen area in my body, and without getting that extra nutrient of oxygen to that spot, it just couldn't do it. And then once it did, it started to heal, So again, it goes back to, I think, that same philosophy of, making sure the body doesn't have too much of the things that it shouldn't have, like toxicity, and then enough of the things that it needs, sufficiency and purity, and then just letting the magic of the body do its thing. So, but yeah, it became a big awareness for me to say, so oxygen's another one of those nutrients that we need to heal in order to sometimes get past the sticking point.
Well, and I'm curious, you look at like neuropathy, and it affects most people distally, right? In their feet or their hands and things like that. And like in your case with this back injury, you were having it in the foot, right? What role do you think maybe circulation played in this as far as getting that carrying capacity down to those distal areas?
So I think that's really where it lies. It lies in the the connection between circulation and the nervous system. So, you guys know this, but basically everywhere you find a nerve, you find an artery and a vein. They always travel together, and they travel together because everywhere you need signaling, you need fuel and you need to get rid of waste. And so we have this body that's, magically put together in a way that, it's perfectly aligned to deliver signals, to fuel itself, and then to carry away the waste products. And so with these injuries, whether they're in our brain or in our back or in our neck, or even if the actual injury themselves are peripheral, like let's say diabetic neuropathy, where the injury itself could be a peripheral injury, it all begins with circulatory damage. When the circulation is damaged, you can no longer carry fuel to the area, and you can no longer carry waste away from the area. And so once that happens, you start to build inflammation. You start to get changes in, the cytokines, all the inflammatory mediators. And then you basically get into a negative feedback loop where the body's just basically stuck. And so it's really through healing the circulatory system and refueling and refeeding that system that ultimately is what allows the nerve to basically wake up. It's not like, in my case, if the nerve was dead, it never would have come back. But in so many cases, it's not that the nerves are dead, it's that they're dormant. When they can't be fed properly, they basically have to slow down and shut down. And so, it wasn't that it was unable to be woken up, because clearly, let's say in my case it did, or in my stepdad's case it did, and so many other cases that we work on. It's just that once the circulation is damaged and the inflammation sets in, and then there's further tissue damage, the healing process is just stuck. And that's really what's happening here. It's healing the circulation. And once the circulation is restored, the nervous system could heal.
Oh, buddy, what a beautiful way to describe that. I love it. And just in addition to what you're saying, one thing I want the listeners to understand is I think people think they have this misunderstanding that we have a ton of microcirculation in our body that uses vasomotion to keep pushing our blood through our periphery. It's not just our heart that's pumping our blood all the way through this system. And what Dr. Saunders is speaking to is, depending on your overall health, how much you move, there's a lot of other factors. This affects this vasomotion and how much we contract per minute to carry this fuel, to be able to have that detox capacity, right? To be able to even have a healthy immune response. So you're talking about this super highway that has to be efficient all the time. And like you're saying, being able to carry these things. And it's so simple, right? I mean, like you're saying, we were designed this way, and all you're doing is supporting the design and helping the system just work more efficiently to get the healing.
Yeah. I mean, I think the biggest difference, I'm sure you guys would agree, is, we're not looking at any of these conditions as, okay, here's, your 11 symptoms you have from this condition. How do we basically support those symptoms? We're looking at, wait, my understanding of the body is that it's capable of healing, right? If I get cut, it clots and then the skin reheals. If I get cold, my body tries to warm itself up. If I get hot, my body tries to cool itself down. The body's constantly, self-regulating and self-healing. And if something's not happening, there's got to be a reason. And if we look a little deeper and try to find it, we could have massive impact. And those impacts aren't just helping people feel more comfortable with the conditions they have. It's actually literally helping those people heal. And that's the difference between what you and I do and some of the other folks. So
no name convention there.
I don't want to not name any name.
Well, another thing that I think that's important to bring up is that you're an active guy. That you're eating right. You're checking all the boxes. We say this all the time on the podcast, is that we're stuck in a culture of, if it looks good on the surface, everything must be working properly. And, when you speak to oxygen, not as like just something we breathe, it's not just this passive experience, it's actually a nutrient for the body. It's so necessarily in the healing process, but you actually had to put yourself under different circumstances outside of the general increased blood flow you get from circulation and non-inflammatory foods. You actually had to increase the pressure. So can you speak on what's actually happening when you're increasing pressure? What's happening inside of a hyperbaric oxygen chamber that allows for increased blood flow and oxygenation?
Sure. So we'll cover that two ways, right? So one, again, I said my background was, fitness and nutrition before chiropractic. So when I started understanding how hyperbaric worked, I was really, like I said before, looking at it kind of like from a nutritional standpoint. And so, oxygen, as I see it, is this nutrient that our body requires to function properly. The thing is this, if you ever had, the pulse oximeter on your finger, right? So if you know what that is and that you've had one, we're all about 98, 99% saturated as we sit here, as you and I sit here having this conversation. So, unless you have a cardiac issue or a respiratory issue, you're already getting almost as much oxygen as you could possibly get. Now, the thing is this, sometimes, like certain nutrients, let's say vitamin C as an example, like sometimes if you don't get enough vitamin C, there's consequences to that. It's called
scurvy.
Exactly. So if you're not getting enough vitamin C, you get a thing called scurvy. And so we all try to get enough vitamin C so we don't get scurvy. But at the same time, we say, wait, I don't just not want to get scurvy. I also actually want to get an optimum range of vitamin C so that I have enough vitamin C to do all the different things inside my body. And then even beyond that, once in a while, let's say I might have a cold, or you could do high dose vitamin C IV drips, for various conditions too, right? So once in a while, it's appropriate to megadose vitamin C in a way that you wouldn't on a daily basis, but because you have some issue that you're trying to treat. So the same is true for oxygen. If you don't have enough oxygen, there's a condition, it's called hypoxia. And if you're hypoxic, you're not getting enough. But not only that, you'd want to make sure you're not just getting a minimum amount of oxygen, you want to make sure you're getting enough every day, every minute of every day, so that you actually have enough to sustain life. For us, that happens to be 98% saturation. So literally almost all the oxygen we could possibly carry at any given minute, we need every single minute just to be here and having this conversation. Now, likewise, if you have an area of hypoxia, like let's say for me with that disc injury, that was a hypoxic area because of an injury. So scar tissue and destruction to the circulatory system. So it's just this living hypoxic area. But if I could somehow megadose that oxygen, I could refeed it in a way that it could actually heal. And so as it stands right now, the only mechanism we have for megadosing oxygen is hyperbarics. So once you're in this pressurized environment, you're allowed to go beyond 98 or even beyond 100% saturated, right? So when we talk about the saturation of our red blood cells, our body carries oxygen through our red blood cells. So if you're 98% saturated, it means that 98% of your red blood cells are carrying as much oxygen as they can. If you fill that little gap, you could say, okay, now 100% of my red blood cells are carrying oxygen. But there's literally, how could you ever go beyond 100%? Well, that's the answer is through pressure, and I'll talk about the mechanism in a minute, but through pressure, you're actually bypassing the red blood cell carrying capacity. So you're no longer even working on that system. And now you're super saturating the liquid portion, the plasma portion of your blood, and you're super saturating your tissue with this excess oxygen. So that's the way we could megadose in times of need. Let's say, whether that's from a performance standpoint, because hyperbaric has a whole like wellness and performance component to it, and it has a whole help me heal from my condition component. It's the same mechanism, but there's different ways we might use that tool based on what we're looking for. So that's just I wanted to give you a little like philosophy on how I look at how it works. But the actual mechanism is basically pressure. So when you pressurize a gas, let's say you could take this much oxygen, and as you exert pressure on it, you can make this much oxygen into a space this big. And then that's called Boyle's law. And then Henry's law says, well, if I've compressed this gas from this big into this big, and now I hold that near a liquid, I can now dissolve that gas inside a liquid. And so the example I use a lot is a can of seltzer. So that's carbon dioxide and water, not oxygen and blood, but it's the same idea. So you could take a bunch of carbon dioxide and you could pressurize it into this can. And then once you pressurize it into the can, the bubbles literally dissolve into the water, making it carbonated. And then when you crack that can of seltzer open, immediately you get this air release, this carbon dioxide release, and over time the bubbles kind of come out. Same kind of thing happens in a chamber. So you take a bunch of air or oxygen and you compress it into a thing, we call it a chamber. And then as a result of being in this pressurized chamber and breathing, you're getting more oxygen flow past your lungs. which allows this extra oxygen to basically be absorbed directly into a liquid, in this case, plasma. And that is how we get beyond that 100% saturation. So depending on your system, you could be easily somewhere between 10 or 15% more oxygenated, all the way up to literally 60 or 70% more oxygenated. Depending on how much pressure you use and how much oxygen you use, those are and how long you stay in it. Those are the three variables that you can manipulate to basically dictate how much excess oxygen you're trying to create inside of a person.
That was a great explanation. And I have a quick question for you, because you're seeing a lot. Okay, so oxygen therapy is having some popularity, but you see different therapies with it. So how does hyperbaric, and I understand, but can you explain to the listeners how something like hyperbaric oxygen therapy would differ than some of these places that are just doing the masks, where you hook up to like a system and you're just, because those are getting really popular here in the Southwest where I'm from. I'm seeing them pop up everyone. Everyone's like jumping into these places to go do oxygen therapy. Right. So how does that differ from what you're talking about?
Good question. So, also maybe, I don't even know, 8 years ago, 10 years ago, like oxygen bars were popping up and stuff like, so, the idea is this. I mean, I think it's not a secret by any means that oxygen is this nutrient that we need. And I think most people understand that there's benefits to getting more of it. And it just depends what method you're trying to use to get that. So if you're living at, if you actually had a cardiac or a respiratory issue, you might not be 98% saturated. You might be 82% saturated. We can't live like that. So emphysema, COPD, things like that. In those cases, you get a green tank, a mask, you put that on, you breathe, and you go from 86 to 95 and you're feeling pretty good. That's important. Now, if you had either a green tank or an oxygen concentrator and you're not exercising, you're basically stationary, you could always fill the gap of, let's say, 96 or 98 to 100%. So even for you and I, if we take a pulse ox and we're at 97 right now, and we get some sort of mask contraption and we start breathing without movement, we can fill the gap of 97 to 100, and we could at least maintain 100. And there's benefit. Listen, it's 2% or 3%. That's not meaningless. It's just not as significant, let's say, as 20, 30, 40, 50%. Now, there's been a movement of, exercise while breathing more oxygen, like HBOT systems, which also are super valuable. The difference there is what you could imagine is you're putting the body under some sort of a load. So now your body's right as you exercise. Let's say as I do some curls, or if I ride a bike, whatever muscles are working are going to require more oxygen. So as soon as you start moving your body, the body says, "Hey, I need more oxygen over here," wherever this body part is. And so we start creating a need for this increased level of oxygen. And then our heart rate goes up and our respiratory rate goes up so that we can deliver, whatever we're breathing more to that area that's working. Now, if you actually do that and you have, let's say, a green tank or an oxygen concentrator, some concentrated oxygen source, and you did that under duress, under an exercise scenario, as you increase the calling for oxygen, you're now breathing a whole lot more than you were. And as a result, you can now deliver a whole lot more than you could if you weren't breathing that. Does that make sense?
Absolutely.
So that's basically, but in that system, you're still relying on your red blood cell carrying capacity. So basically you're saying, listen, I was 98% saturated. Now I'm 100% saturated. I'm exercising. So now I've increased my calling for oxygen and I've increased my demand for oxygen. I'm going to increase heart rate and respiration rate. So my heart's going to beat faster. I'm going to breathe, deeply and more quickly. And there I'm going to start drawing this excess oxygen to that working tissue. However, I'm going to do all of that still based on 100% saturation and still based on the fact that my red blood cells are carrying that oxygen. There's a tremendous benefit to that. I don't want you to think that there isn't. The biggest differences that I see between, let's say, a system like that and hyperbaric are twofold. One is this difference between, am I still utilizing the red blood cell carrying capacity versus am I actually going above and beyond that? And because of that distinction, hyperbaric does allow for a great deal more oxygen capacity than a system like, an oxygen system with exercise. Mm-hmm. The other distinction is that hyperbaric is passive, and let's say these other like HBOT systems or whatever they are active. And what that means to me, though, is that you're now isolating a population group, because you have to be able to perform that exercise in order to get the benefit. And so depending on who you're treating, if you're treating, an endurance athlete, they're going to get a lot out of that system. I still think they would get more out of hyperbaric, but they're going to get a lot out of that system. If you were treating my stepdad with MS, you're going to get nothing out of that system because he couldn't even pedal the bike at the time that we started the process. And so hyperbaric just also allows a larger population base, because you're taking the activity level, you're taking the intensity level away to allow for basically anybody who could lay still and breathe and benefit.
Mm-hmm. And maybe that's a good segue into the next piece, which is just clinical application, because you could talk about, you're not going to put a baby on a EWA machine for a pregnant lady, or any of the, like you said, someone with MS. Let's talk about some of the clinical applications, and jump in.
Sure. Okay. So they're pretty broad. I mean, if you think about, again, if you just think about the mechanism behind, hey, oxygen is the fuel for cells to detoxify, heal, and make energy, then pretty much anything that needs to either detoxify, heal, or make energy benefits. Mm-hmm. It's literally, that simple. Now, that being said, you have to look at different clinical cases, because protocols would be a little bit different based on what the conditions are. And, the intensity of the pressure, the amount of oxygen, the duration of the treatments would all differ, depending on, I think, on what the goal is that you're trying to get clinically. So, but I mean, it runs the gamut. I think the things we see a lot in our office, a lot of neurologic conditions. So post-stroke, autism, MS, TBI, and concussion. We see a lot of autoimmunity, like inflammatory bowel diseases, the MS, ALSs, a lot of these neurologic degenerative, dementia and Alzheimer's. So, I mean, a lot of different types of issues. And again, it's not that it's curing these diseases. It's strictly that it's giving the body this tool that it needed to help it recover. I think along with other cancer treatments, hyperbaric is starting to grow in popularity. So we're seeing a lot of that now too. So, but again, it's all about getting that body to heal. Let's say, post-stroke, in those cases, neurologically, there's literally circulatory damage. I mean, that's what it is, right? It's circulatory damage. It's just the same thing I was describing with my back. Damage to the circulation tissue, damage to the brain tissue, and then a whole area of dormant brain tissue that just can't get fed. When you introduce hyperbaric oxygen, now all of a sudden this area is able to get fuel that it couldn't get any other way. And as a result, it could actually wake up that dormant tissue. Not only that, I mean, there's two pieces, back to the circulatory healing component. There's two pieces to that. In the short term, because you're bypassing the red blood cells, you're literally getting oxygen directly to a source of injured tissue. The second piece is, after long-term periodic exposures to this hyperbaric environment, you're literally going to start building, it's called angiogenesis. You're literally going to start building new blood vessels to that damaged area, so that once you stop doing hyperbaric, you now actually have a brand new, circulatory highway to continue feeding that system well beyond, the actual treatment. So it's really, there's two pieces that I think are pretty important in terms of understanding how does it improve circulation. TBI and concussion, it's the same thing. Autism, there's a detox component to it. And again, a lot of kids with ASD, they have decreased blood flow to their temporal lobes of their brain, which is one of the reasons they think that maybe there's a lot of language barriers with autism. But again, same thing. Now if we have decreased blood flow to an area of the brain, and now we're exposing that brain to these increased oxygen, the whole purpose of circulation ultimately is to get that oxygen up. So this increased pressurized environment increases oxygen, increases blood flow to the temporal lobes of the brain. Dementia, Alzheimer's, it's all, if you understand, again, the mechanism behind it, you start to understand how that plays out. So in toxicity, it's basically the same idea. Hyperbaric shows a lot of decrease in cytokines. Cytokines are the chemicals our body uses to promote inflammation. And so hyperbaric oxygen does a great job at reducing those inflammatory cytokines. And it gives the body the fuel, the mitochondria, the fuel to really, again, fuel to make energy, to pull out toxins, then to reheal. So again, a very similar mechanism based on, so many different conditions that benefit from it. Okay. Another quick one is just infection. So a lot of infections are anaerobic. What that means is the bugs, the infections, they don't thrive in high oxygen environments. They actually thrive in low or no oxygen environments. And we see this in the gut with inflammatory bowel disease, but we also see it with things like Lyme disease. These infections are literally anaerobes, and they create these biofilms that protect them to have these very low oxygen environments so that they could thrive off of our system. And so again, this hyperbaric environment, what it does is, one, it heals tissue. Two, a lot of the microbes, the microbiome that we have that are the good guys, the probiotics, they actually love oxygen. So what happens is this high oxygen environment, it creates a scenario where you're literally feeding the probiotic some of the fuel that they need to do well. And at the same time, you're exposing these anaerobes to a high oxygen environment, which actually helps to kill them. It starts to act like a natural antibiotic in a way. So
I have a quick question since we're talking about the gut.
Yeah.
Have you guys addressed any SIBO using hyperbaric chamber therapy?
Yeah. So again, in the beginning, for whatever reason, it was almost like a last resort for us. It'd be like, well, let's address, these inflammatory bowel issues or the SIBO. Let's address it from, a nutritional standpoint and, a detox standpoint, all these, natural antimicrobials, all this kind of stuff. And then if all those things didn't work, we would try oxygen. And now I'm like, wait, it's just oxygen. Why am I waiting until the last case to do this? So it started to become, more of like a front loading scenario. So if someone has a great deal of bacterial imbalance, it's one of the first things we do, because exactly for what I just said. I mean, if you're basically, if these bacteria are anaerobic, which most of the pathogens are, almost all of them are, and yet either the probiotics are either oxygen tolerant minimally, but most of them are literally oxygen loving, you could start to shift the environment. I mean, you guys know this. It's not that we're infected with bad guys. It's that the environment is conducive to allow these pathogens to live there. And if we can shift the environment, we shift the microbes automatically. So, rather than even taking, let's say, antibiotics or even natural antimicrobials, we start a process of trying to shift the environment first, start to make it conducive for all the probiotic to live and thrive and do well, and start to make all these pathogens have an environment that's actually very difficult for them to live in. Then, if we need to, we start with the antimicrobials, the detox, the food changes, all that kind of stuff.
And I'd imagine that oxygen, as a nutrient, when you're taking a multi-therapeutic approach, it's just making everything at a cellular level just work better.
Right. Again, you guys know it's certainly, it's not the only tool we're using. We're doing all, we're doing, TCD, we're doing fasting, other supplements, we're doing infrared light. We have all kinds of different things going on inside that office. But in addition, in that multi-therapeutic approach, again, why not? Here's this nutrient that we require. Let's megadose it periodically to get that excess fuel so that we could just give the energy to the body that it needs to do whatever else it's trying to do.
Well, and I love how you're talking about how it's environment changing in the system. That was a very good analogy, man.
Thanks.
Yeah, you're painting a picture that's so important for people to understand, and that is that environment and all these blood gases, the hormones, the toxicity, all these things are influencing the soup or the plasma. Right. And how are you feeding your tissues? How are you feeding your cells? And amazing, is when you're speaking to the different conditions, we're not it's like we step outside of the discussion of disease diagnosis altogether and just get down to simple mathematics and flow and everything. And this really just comes down to always what we try to teach people is that when you can get subtractive in your approach, when you can remove the things that are causing the injury or the tissue insult, et cetera, and you provide the right environment, anything can shift. And you're not treating an illness, you're creating that system for change. And I mean, at this point in the podcast, I don't know who doesn't want to jump into a hyperbaric chamber. So
I'm already looking for them in El Paso.
I'll throw you an arm.
Yeah,
I think you're gonna have to sell me one, Doc.
Yeah, I want one too. We've been talking. So, I mean, on that note, like, how do people access this? Because you did a great job of explaining how there are hyperbaric chambers in hospitals, but they're only allowed to be used under certain criteria. You probably have to access private clinics to open up, the scope of getting access to these. So, can you speak to that a little bit?
Yeah, sure. So, yeah, I would say that the way I describe it, there's sort of 3 levels of hyperbaric chambers out there, more or less. So on the far end, like you said, it's, like hospital grade chambers where, these are chambers, they're being literally the whole chamber is being filled with 100% medical oxygen. And in order to really gain access to that, you need to have one of right now 14 specific diagnoses. So, and they're pretty bad things you don't want: gangrene, osteonecrosis, radiation burns, pretty serious issues. Then there's a sort of a medium version where you're still getting a lot of oxygen and you can get pretty high pressure, but you could do that in a private clinic setting. And, that opens up a door for a lot of other pretty serious conditions, things like we were just talking, post-stroke and dementia. I mean, these are really serious issues, SIBO and IBD, and but it doesn't have to be in a hospital setting. And the way that they could be put together is a little safer, with a little bit more guidance in a private clinic than it is in a hospital setting. And then there's a whole other category which is considered mild hyperbaric, which is very safe, and it's not as much pressure, it's not as much oxygen, but again, it's a lot more than what you and I are getting right now. So even in a mild system, you're getting 20 to 30 some odd % more oxygen than what we're getting right now having this conversation. So it's still a significant amount. And the restrictions are even less, and the safety is even higher, and the outcomes are equally fabulous. So, those kinds of chambers, some people put them in their houses, docs could put them in their office, very easily with, minimal amount of changes to the office. They run off of, typical, 110 outlets. So the access to something like that has become, really a lot easier than it used to be. And, it's allowing patients to get, treated in a way that it just was impossible prior to getting that. Real quick, I want to make a mention. You had mentioned, about sort of the differential in philosophy. I use that soup analogy a lot too. And it's like, you either think that the body's just degrading and breaking down over time, and you're just sticking a bunch of Band-Aids on things and trying to make people as comfortable as they can be, throughout their decline of life. Or you think the body is self-healing and self-regulating, and if we're not seeing that, then there's a problem, and we need to do some detective work to figure out what that problem is. And once we fix it, we let that body heal. So, I think that's like the most fundamental difference between sort of a functional medicine or regenerative medicine type thought process, and like traditional allopathic docs, is just that that soup. Again, you're trying to get into some mode where, you're looking at it, you're looking at this body, you're saying, here's all the stuff that's going in that's great, here's all the stuff that's going in that isn't, and how do we find a better balance, again, in that environment? How do we shift the stressors, the chemical stressors, the physical stressors, the emotional stressors? How do we shift that soup in a way that just allows that body to express health versus why is that, body expressing some sort of illness, and that's not curing disease. That's just improving health. It's letting people express, the optimum health and wellness that I think we all deserve to. So I just wanted to make a quick mention on that because you had said something earlier that made me want to share that. So.
Well, there you go, everybody. You want to have some tasty, delicious soup. Don't be filling your soup bowl with crap, right? Yeah. Oh, I love the I mean, that's absolutely, we're all about paradigm, and we're always talking and coming back to that. And it's so important. I mean, with what you just said, Doc, if you're not there already and you're listening to this, that's probably why you're still not getting well. So that right there will just shift you in the right direction of where you need to get going on, right?
I can't help but think like, okay, I'm in the hyperbaric chamber. What are all the other cool technologies I can use while I'm in there? So I'm curious, like, you know, when you're doing self, like we can take this, we talked about illness and stuff like that. How do we look at this from an optimization point of view, an upgrade point of view, you know, and like, what are some things that maybe you've played with while you're in there? Like, I'm thinking like photobiomodulation and infrared light or whatever. Like, I'm just thinking, how can I link this to like 10 other things? So
Yeah. You know, in my head, it's like, how do you just lay there for an hour? You're getting, you know, hyperbaric oxygen, some red light, some PMF, an IV drip going through, right? Just bring it all in. Yeah. You know, especially in some of the higher pressure, higher oxygen environments, you have to be careful. You really can't do a whole lot. Just because of the oxygen levels and the amount of pressure, things have to be able to like withstand that kind of a thing. In the mild versions, you could do a lot. So they sell, first of all, whether it's wired and you have to like send it through a port, or they sell, you know, battery versions. You know, people could combine the beamer or PMF, definitely photobiomodulation for sure. You could use, you know, we were talking about different ways. So the mild chambers are basically pumping in air only, but even just doing air only, you're still getting a great deal more oxygen. You could also, from there, you could add an oxygen concentrator to that. So now you're pumping in additional oxygen in addition to the air that's going in there. So you could add oxygen to that, red light to that. One red light company that we've been looking at, they also have, you know, a photobiomodulation and a PMF component to it. You know, so, you know, we've definitely played around a little bit with a few of these. You know, I love the idea of just, you know, trying to be efficient with time and, you know, also get a lot of great things done. At the same time, some of the tools that we use, you know, like for photobiomodulation, like some of them are pretty high powered tools, and, you know, they're just can't be combined. So I'll do, you know, 30 minutes or an hour of this, and then I'll do 10 or 15 minutes of that, you know, and I'll just put them together in a session. But yeah, I mean, the opportunity to definitely combine some other therapies too. I'm sure you have some good ideas around that. And it's, you know, there's enough space typically in them, and they're safe enough to be able to do things like that. So for sure.
Well, and outside therapies, is there any things that you guys do to maybe prime the body before you put them in the hyperbaric chamber, or post? I mean, I'm just curious, out of curiosity.
Yeah, again, a lot of it boils down to the state that the patient's in before going in, and then what the goals are in general. So there is a piece of hyperbaric oxygen that could increase, let's say, oxidative stress. So, you know, typically the amount that it increases is not a lot, but some patients can be pretty sensitive. So there might be times where we might front load, you know, a period of antioxidants, let's say, as a way to sort of lower the oxidative stress before going into the chamber and being exposed to that. You know, there's huge, you know, again, if you want to, let's say for optimization, like you were saying earlier, like, so I had a woman, she's 78, pretty significant degenerative disease in her hips, and she wants to do stem cells. So she's a chiropractic patient. She hasn't done any of these other therapies that we're talking about. You know, she's getting better. She's definitely mobile. She's exercising, but she's not where she wants to be. You know, so she's asking me questions about stem cells. We don't do that in our office, but we have some docs that we work with. So we're talking about it. I'm like, listen, well, what are you willing to do? And she's like, literally, I'm willing to do anything. So we start her doing keto. We detox her. We get her fasting, right? As I'm sure you've talked about on these podcasts before, but, you know, we're clearing out inflammation. We're optimizing her own stem cell systems, right? So we're basically starting a process where her body's already optimizing, you know, energy metabolism, minimizing inflammation, and beginning a stem cell release process. Then we're adding high dose red light, which is going to further her energy production and stem cell release. Then we started adding hyperbaric oxygen, which is going to further reduce inflammation, further increase stem cell release. So she goes to this stem cell doctor. The doctor's like, listen, I'm happy to do it. It's very expensive. You're 78. I wouldn't expect miracles. And she's like, well, I still want to do it. So we go through a process. We do this thing for about 4 months before she ends up going for the actual retrieval process. So she goes for the retrieval process. They do the retrieval. They spin it down. And they were like, what are you doing? They were like, how? We've never seen a 78-year-old have that much of a stem cell retrieval. What? And the guy actually ends up calling me because he's like, literally, I've never seen somebody this age in her condition come out and have that type of stem cell response. Like, what are you guys doing? And I'm explaining, but again, it makes perfect sense, right? It's not magic. We're literally just taking all the systems inside the body that we know how they work. We're already manipulating them and shifting those environments to create this regenerative approach. We're just timing them in a way and strategizing in a way that basically just takes this person through a process of, increasing their physiology. Even though she's 78, you have to agree, most of us are not as well as we probably could be if we actually went through and did all those things, right? So, her going through that, it was massive. And then her response to the therapy was, she's like a poster child, because she literally did everything I asked her to do to a T. It was really beautiful. She's 78, she's checking blood ketones and glucose, she's fast, she's doing 3 to 5 day fast. It was a lot of fun because she was, she's obviously pretty nervous going into it, but her optimization was incredible. It was really cool to watch.
If that doesn't just spring a whole lot of confidence in the human body, I don't know what would. I mean, the power of what someone can take control of in their life to get that kind of feedback. I mean, not only is that amazing just for her to see that as a victory for herself, but anyone listening, I mean, if you think you're down and out and your body has no way of coming back, here's an amazing example of a situation where the body has an incredible healing capacity. And like you said at the beginning, it's like the body wants to move towards health. We just create the right environment.
Just need the right ingredients, right?
That's
and so many nuggets and lessons in what you just spoke to, Doc. I mean, I just spoke in Chicago at a stem cell conference, and we were talking about the importance of prepping the body before you do anything like stem cell therapy, because they don't take. And so for the listeners that are listening, if you have, like what Dr. Saunders is talking about, if your body is not in a healthy state and you're massively inflamed and you're toxic and you're having all these things going on, and you try to go and do something like stem cells, it's not going to work out very well for you. So the analogy of you have like this old house on this lot that's abandoned and it's breaking down, you got to clean up the mess before you go and try to rebuild. And that's basically what he did. He went in and cleaned up the system and optimized it so that these things would take the best way possible so she would be successful. And then the other nugget that you're giving is this lady's 78 years old. Yeah. When we're talking about the fact that our bodies can heal themselves, and you're never too old to allow this to take place. So that soup, you made her a delicious soup, buddy.
We took 78-year-old soup. We made it like 26.
And that stuff's been marinating, right?
Yeah. I mean, it's, and it makes sense too. You think about it. It's like if you have all this inflammation and debris and all, you throw a bunch of stem cells, they can't live there. How are they going to live? So you're exactly what you said. You're optimizing the environment. You're getting the body ready to accept this shift in a way that you're feeding it, you're nourishing it, you've optimized it, and then the body's totally ready to just take that and just run with it and actually, heal. So yeah, it was a great experience to watch that all kind of come across.
We are running close to the end of the time, but I do want to just quickly speak to the use for kids, because obviously we're all dads. We have kids. There's a lot of kids suffering out there with so many different issues. Can we talk about just safety, maybe some contraindications, and what parents need to know if they're going to consider using this therapy for their kids?
Yeah, that's a good point. So the youngest we've ever put in a chamber is probably 2 months. Average, I mean, again, it's so condition specific, but and that kid was actually was a stroke in birth. Wow. So in these scenarios, again, you're weighing risk and benefit, right? And in so many of these cases, these chambers, they're very safe when used properly in the right environment with the right pressures and oxygen levels. They're very, very safe. So, but typically, even with a kid up to 9, 10, 11 years old, often the parents are going in with them. Mm-hmm. So, a lot of these chambers are big enough now where two people could fit pretty comfortably, and but it's very condition specific. So, these kids that we're treating, a decent amount of kids that are somewhere on the spectrum, again, they can go in with a book, they can go in with like an iPad or something to keep them busy, whatever. Sometimes they take a nap, sometimes with like the high oxygen environment, a lot of times we're just sort of, things calm down a little bit and, kids start to nod off too in there. So, I mean, it's very safe for kids. Parents are always more nervous than the kid. The kids think they're either going camping or they're going in a spaceship. So that, kids are like, I want to go in the chamber. And parents are like, I don't know if Johnny's going to go in there. So I'm always like, I'm pretty sure they're fine. And you might be a little nervous. So we'll take it slow with you and we'll get you comfortable. So, but it is very safe for kids. Typically we won't really do a lot of really young kids, like 2 months old, 3 months old, unless the issues are warranted, like a post-stroke or, a brain bleed, something like that. I mean, again, it's so safe and the benefits are so high for a kid in that scenario that it is worth it. There's no contraindication even specifically for pregnancy, although we really we don't treat pregnant women, more just from the standpoint of like, again, it's a risk to benefit. Most of the issues that we would be treating, they're not so time sensitive that it's like, let's just wait until you deliver and we could start treatment afterwards. God forbid anything goes wrong, during the course of the pregnancy. You just don't know, again, in that soup, what may have triggered something or not. So it's not dangerous. It's not contraindicated at all. As an office, we just don't do it because we don't like to, I'm just very conservative when it comes to pregnancy. I really want the body just to do what the body does. So, but with kids, super safe. Inflammatory bowel disease, autism, a couple of these, little ones that are like near drownings or strokes in birth, or even nerve damage like Bell's palsy or Erb's palsy. A lot of these that might happen early on. I mean, they're very safe to be treated in the chambers, and they do pretty well.
Mm-hmm. How about diabetics?
Absolutely. Yeah. I mean, there's actually even some evidence about the oxygen levels helping balance insulin. But most importantly, with diabetics, you're talking about, protecting the circulation again. Mm-hmm. So, a lot of the eye issues that are going to come out from diabetes, a lot of the neuropathy that's going to come out from diabetes, it's all sugar damaging the circulatory system. And again, we're just going back to how does hyperbaric affect the circulatory system? And therefore, how does it then help protect the retina? How does it protect the extremities from neuropathy, all that kind of stuff? So absolutely, it's got a pretty big place there. Diabetic, like really, really terrible diabetic neuropathy, that would actually be one of the 14 indications that you could even get treated in the hospital. But again, in my mind, it's like, why are we waiting until the diabetic neuropathy gets that bad before we use oxygen? Even in the hospital setting, I mean, if you have a non-healing wound, which hyperbaric's amazing for non-healing wounds. If you have a non-healing wound, I think you need basically like 4 or 5 rounds of antibiotics over like 3 or 4 months before they'll even consider hyperbaric oxygen. I'm like, why are we waiting? Mm-hmm. If there's something wrong here and oxygen could help, shouldn't that be like a first line of defense, not a last line of defense? But for whatever reason, it still lives there in traditional medicine. But obviously, then that's why you would go to a private clinic and find clinics using it, because you can get ahead of things, much faster that way.
Got to be your own doctor sometimes, right?
Yeah, often these days.
Well, I gotta say, like, hearing your story, hearing your passion for what you've accessed, what you've had your own self-healing on, seeing the countless number of people that have come through the clinic to receive this benefit. I mean, we see why your mission is so big, and it's wonderful to hear that. Where do you see this going? What would be your dream for hyperbaric therapy? What do you see for the future of this?
It's interesting. Hyperbaric's been around for 350 years, I think. And that being said, I think it's literally at its, infancy right now in terms of opportunity and in terms of benefit, understanding, the mechanisms and getting people access. I think if I could design a world, it would be where, as an example, I mean, in New Jersey, I might be one of the only clinics, that operates the way that we do with the types of equipment we have and the oxygen that we have. There should be 30 of them, in New Jersey, let alone, across the country. So, I mean, if I could design a world, I would design a world where, people understood at the basic level that we talked about today, where this fits in their healthcare. And it would be something that would allow people access, and, so doctors would start utilizing it more, recommending it more as a frontline defense on so many issues that, we just let get out of control. People end up in our office literally as a last resort, and it's a shame to me because while they still get great results, they suffered for years before they got to us, and they didn't have to. If that was just like an initial thought in so many people's minds, in their doctors' minds and their families' minds, if it just became something that was like, oh yeah, you have this, go get some oxygen, it would be, it would change so many people's lives. So, I mean, that's kind of what I would see. I would see a world where this just became like as common as, taking vitamin C. Oh yeah, I need some oxygen. And it would change a lot for a lot of people. Quality of life,
Kind of makes you question where everybody's putting their money and research and all these things into, and how much wasted time there's being on certain things that have no weight compared to something as simple nutrient as oxygen, right?
I mean, that's what it is. There's no money in hyperbaric. There's nothing you can it's just not a new drug. It's not an expensive procedure. It's really a simple, safe, inexpensive tool that does amazing things. And so it's almost like it's been it has been completely overlooked as, like a frontline, major therapy for so many people.
And for our list, or go ahead, Nick.
I was just saying, the way you're speaking to it is no different than eating food.
Right. I mean, I literally look at it like that. Yeah. It's like, I ate lunch today. Actually, I didn't, but, but, I eat food, I drink water, and I get oxygen. Like, why wouldn't you?
Yeah.
Well, and for our listeners real quick, and this is from my experience, and I'm sure both of you would agree with me here, is like you were talking to, there's no money in it. And what I have found, the things that there's no money in are usually the most potent medicines, and they're not being developed. And then we're spending billions of dollars in research going on this goose chase for these random things that have no efficacy just because they're trying to monetize. So for our listeners, you need to think outside the box and look at some of these things that like we're saying, like Dr. Nick's saying, is that are more simple, and you're subtracting, going down to foundational things like Dr. Saunders is saying, where you're just supporting your basic function of your system to allow it to heal.
Mm-hmm. It's literally that simple.
Let's send these guys with some home play. Dr. Jason Saunders, at the end of every episode, we always give some suggestions on how to implement some of the tools that we're speaking to. What's a place where someone can start? Maybe even just that prep leading to, as you mentioned, that 78-year-old woman, the stem cell support. But how do you invoke this this process for people?
So, I think a couple things. One is, I think with the amount of information online, it's a blessing and a curse, right? So it allows people to get all kinds of fabulous information, and also allows people sometimes maybe too much information, and allows people sometimes not always the most accurate information. So, I think it's really important to become a educated healthcare consumer. So I don't disagree with people learning at all. I want you to, but I do really, really strongly recommend people, like, you need to find providers that you can trust, and they're not to treat you, but to work with you, right? To help educate you further, to bounce ideas off of, to consult with, to talk with, to understand why what's happening to you is happening. So I really feel like people need to build these days. It's not like you just have one doctor, you just do whatever they say. You got to be in a place where you have like a team of people, and maybe each one fills a different piece of that niche for you. And you have these people who are willing to work with you on that team and discuss your issues and your concerns and the varieties of options that you have, that you could make the best decisions that you could make. So, I mean, I think that's one thing I try to encourage all people out there to do. I think that's a huge piece. And then the other thing I think that's, really critical, again, if you go back to that sort of soup idea, we're constantly, stress is anything that causes a change in our body. There's good stress and there's bad stress. And, to me, again, if you get into this mode of understanding, here's all the things that my body needed, here's all the things that my body, is hurting me, and you're trying to understand that relationship, and you're trying to get into a mode where, you're doing more for yourself than you're taking away, you start to let that body heal. And so one of the things I have patients do is I say, listen, there's physical stresses in your life, what you do to yourself. There's chemical stressors in your life, that's everything you put inside your body. And there's emotional stressors, that's everything you think about. And if you start to understand that that's the three places stress comes from, and you understand that there's good versions, healthy versions of those stressors, and there's unhealthy versions of those stressors. And then within all of that, there's the ones you have control over, and then there's the ones you have no control over. And you literally start breaking out lists of, here's my emotional stressors, positive, negative, ones I have control over, ones I don't have control over. Here's my physical stressors, positive, negative. Here's the ones I have control over, the ones I don't have control over. I literally have people make lists like that. Awesome. And we start just focusing on the things you have control over. Because I think so many times we just get so bogged down in these, life events and things that we just literally have no control over. It just makes us even more stressed, more overwhelmed, and, it doesn't let us actually take action. If you have a list of things and you could actually do something about them, one, you're focused on something that you could take action on. All of a sudden you're feeling productive. You're feeling like, hey, I could do something about it. And two, you're just not focused on all this other overwhelm. And so I think that just allows people to kind of, one, understand the big picture of how we get where we got in terms of our health. And then two, it starts to just lay out a strategy of like, how do I chip away at this? And so those are probably the two big sort of take homes that I think if people did that kind of thing and thought about their health that way, they could probably make a pretty big impact in where they are.
Huge nugget. We should have a little sound effect that goes off when some of these guys. No, for real, man. Yeah. For all of you listeners, he gave lots of nuggets in this episode, but that was solid, man. That was well said, man. Again, he's an old soul. We told you.
I'm actually 90, but hyperbaric oxygen. Keeps me young, man. I'm fasting. I'm getting oxygen. I'm doing it all too.
So, Doc, where can people access your work, workshops, books, social media? I mean, anything. Where can people find you so they can learn more about this?
So, locally, we have our main office. That's Core Therapies. Website's coretherapies.net. We also have the hyperbaric part of that, which is New Jersey Hyperbaric Oxygen. We have HBOT USA, which is basically our main site for just hyperbaric oxygen in general. So that's hbotusa.com. Online, I'm not, you guys know this about me a little bit. I'm not I don't know all the social media stuff that well, but my wife does a bunch of stuff, and it's Doctors Sonners, DRSSONNERS. So I'm on there a bunch because they capture me in moments like this and then they post it and stuff, but, so it's Doctors Sonners. Facebook, I think, is something like that too, Doctors Sonners. I wrote a book a couple of years ago, Wellness to the Core, so they could check that out. It's on Amazon and stuff. I have an HBOT book coming out, but it's probably another 6 months before that's actually up and running. So, but yeah, I think
we can have you on again when your book launches.
Sure, that'd be great. Yeah.
We just scratched the surface of what you have to share.
I would love to.
Yeah. And everything you listed, we'll put in the show notes for everybody to tune into. And if they can't catch you on Facebook, they'll be able to catch your amazing wife.
Yeah. She's doing some amazing stuff.
Amazing things too. Yeah. All our wives are. And for you listeners, we're all doctor dads, but we're all married.
And we all have doctor moms.
There's Dr. Moms. There you go.
All of our wives are, they're doing great stuff.
Yeah.
It's fun.
Doc, thanks so much for coming on with us today, man. This was awesome. I learned so much just always speaking with you, and this was great.
Thanks. Yeah. Thanks again for having me. It's I love if it was 2 hours or 3 hours, we can keep going, right? So I don't mind once we're going that we keep it going. So thanks for having me, and thanks for having me on. And anything else that pops up, let me know.
Cool. Awesome. Thanks for being on. It's awesome.
Yeah.
Well, there you go, everybody. Another great episode with Dr. Jensen Saunders with a lot of nuggets in this one. So get your nuggets on this one this week, and we will see you guys next week. Thanks a lot.
Ciao.
Take care, guys.